Our next guests are Bonnie Hood and Ginny Czimber. Well, welcome to the show, guys. Ginny, Bonnie, it's such a pleasure to have you guys here today.
Thanks for having us.
Yes.
And I would like to begin today by just getting to know you a little better and letting our viewers know about yourselves and what you do. So let's start with you, Ginny.
Okay.
And I understand that you already lived here. Is that correct?
That's correct. I've lived in Brunswick County for about 8 years.
Wow. Do you love it here in Brunswick County?
I do love it in Brunswick
County.
County.
We all
no
do.
snow.
I know, it's great. And tell me about your education and your background.
Okay. I got both my bachelor's and master's degrees in nursing at Stony Brook University in New York. Once I completed my education, I went to work at an endocrinology office in Wilmington and left there earlier this summer and moved over to Oceanside.
Oceanside Family Medicine and Convenient Care in Charlotte. Great. Likewise, Bonnie, I think you're new to the area, though, right? You moved here from somewhere.
Yes, yes. And I love it here.
How long have you been here now?
Less than 2 months.
Wow, you're still a newbie, huh?
Yes.
Yeah, it's great. And you're also at Oceanside Family Medicine.
I am.
In what capacity are you there, Bonnie?
I am a physician assistant, and I work in the convenient care clinic.
Great. That's a great clinic, and it's such a great thing for the county, for Charlotte, to have that available to them. Ginny, getting back to you, what is your primary focus at Oceanside Family Medicine?
My primary focus is diabetes management. I spent the last 6 years, as I said, working in an endocrinology office, and so there was a definite need in Brunswick County for somebody with my skill set, and so I agreed to come down and help Oceanside Family Medicine and Novant in general to better manage their patients who are out of control with diabetes.
And how did, and this question is to both of you, what made you decide to sign on at Oceanside Family Medicine and Convenient Care? What about that practice interested you?
It offers me the opportunity to combine the two things I enjoy doing the most, acute care and diabetes. I'm also a certified diabetes educator, and I look forward to working with Ginny, maybe doing some classes for the community.
Yeah, so you guys have that commonality there.
Right. Yes, Bonnie is going to be a wonderful asset for me. I have a lot of experience managing diabetes, but I am not a certified diabetes educator, and so her knowledge will complement my practice perfectly.
Oh, that's great.
Yeah.
And were you familiar with Oceanside Family Medicine prior to?
I have lots of neighbors who are seen as primary care patients at Oceanside Family Medicine. And so they came very highly recommended to me.
Wonderful.
And once I had been to the clinic and met all the providers, I knew that I would fit in pretty well, and it would be a place that I would really enjoy working.
We actually did a show a while back at Oceanside Family Medicine and Convenient Care and took a tour and showed the whole office. It is a beautiful office.
It is.
It's a great place. Dr. Eisenhower has a wonderful setup there. So you briefly touched on the other providers. Let's talk about some of those and remind our viewers who else practices at Oceanside.
Okay. Well, there's Dr. Clark Pritz, Dr. Angela Thompson, and Dr. Eisenhower.
Marie Whitley is a nurse practitioner. John Fillmore is a nurse practitioner.
That's right.
And Tiffany Lewis is a PA.
And now the addition of the two of you.
That's
really growing down there.
It is.
Quite
it's
a few
growing
people.
Quickly.
Yes.
Yeah. Well, some of our viewers out there may not know exactly what a family practice is, and that is what that is. It's a family practice. So let's talk a little bit about that. Maybe tell our viewers what constitutes a family practice. Do you want to answer that, Bonnie?
Sure. Taking care of the entire family.
The entire family.
Yeah.
That's pretty simple.
From birth to death.
Oh, yeah. Well, that's good. And you don't have to go to all these different places. You can just stay at one practice
Right.
and have it all taken care of. And you can bring grandma with you. And then, oh, by the way, my granddaughter has a cold or whatever.
And
So
often it's the same provider who provides care for all the members of the same
That's
family.
really nice.
And so they know the family history, they know what's going on, you know, socially and emotionally and
Right. And sometimes that's as important as that actual
right.
symptom that they're exhibiting.
Absolutely.
That's great. I think you guys are going to be really happy there. I'm so happy that
I think so too.
Yes.
that you've joined on there. Let's talk about some of the services and procedures offered at Oceanside. Now, you work in the convenient care side, and how is that open every day?
It is. We are there 7 days a week. Weekdays, we are there from 8 a.m. to 8 p.m. Saturday from 9 until 6, and Sundays from 1 until 5. And it's a walk-in clinic, or people may call and make a same-day appointment.
Good information. Now, I assume there are some minor procedures done in the office. Can either of you elaborate on that?
I'll let you do that one. More of them.
We do.
Do you
some
remove fish hooks? Because that's
su-
important here.
Yes, absolutely. And
Some of us.
quite a bit of suturing.
Oh, no. That's from all those oyster shells, right?
Yes.
Especially this time of year, right?
Yeah.
Yes, and remove some skin lesions,
Oh, okay.
ingrown toenails.
Okay.
Yeah.
So quite a few things, really, that wouldn't necessarily require a referral to a specialist or
Right.
surgeon.
Or an
anything.
emergency room.
Do either of you have any special interests? Now, I know that yours is diabetes. That is your special interest or your particular focus. How about you, Bonnie? Other than the diabetes education, do you have any other special focuses or?
Well, the acute care.
Yeah. And do you also do like women's services?
We do. Yes, we do. Well, women exams.
Right. Well, that's good. You've kind of got a one-stop shop there.
We do. We also have lots of radiology services, ultrasound,
Really?
ultrasound, X-ray on site.
How about lab?
We have our own
Yes.
lab. You know, they're sent out, you know, to be
Right.
cultured or read or processed. But we have our own lab techs in the office.
So you
all
do
day
all
long.
the blood draws right there.
Yep.
And you can do ultrasounds and x-rays.
X-rays.
That's also very good to know. So that if somebody walks into convenient care and they've got like maybe something might be broken, they've got x-ray right there. Wonderful, wonderful. Well, it's been a pleasure having you two on today. I look forward to bringing you back at a later date when you've gotten some time under your belt and see if we can delve further into the diabetes portion of it. Because I think in this area, that's a real important topic.
So do I.
So-
Yeah. But thanks for having us.
Yes, thank you very
it's been a pleasure. I
much.
look forward to seeing you very soon.
Okay.